ABC. Good evening, everyone. Thanks so much for joining us for Facebook Live Primary Care. We're so excited to have you with us tonight. We're here with three of the finest with Mon Health. We're so excited you ladies could join us. We have a girls' night tonight. So just get your questions ready. Make sure you have them ready for the three primary care physicians we have here tonight. Everything under the sun for primary care. So we thought we'd just go down the line and have the three physicians. We have Dr. Ariel Plackey, we have Dr. Marilyn Bonfili, and we have Dr. Gabrielle Sakalaridis here. So if you guys want to talk about your specialty, obviously primary care, but what led you here to Morgantown and why you really chose Mon Health and why you chose primary care. Dr. Plackey, you want to start?
Sure. State and LECOM for undergrad, or LECOM for med school, and then my husband and I met in residency in Johnstown, Pennsylvania, and he wanted to come back to West Virginia because he's from here, and then he did some rotations at Mon in med school, so that's how we kind of ended up here. And so it's kind of nice to have a surgeon to reach out to here and there. And I chose primary care just because I love like interaction with patients and kind of that one-on-one conversation like experience.
Perfect. Thank you. Dr. Bonfili.
So I'm originally from Morgantown and went to school at WVU, medical school at WVU, residency at WVU, so I was ready to leave after that. Practiced in the Eastern Panhandle for just over 5 years and really enjoyed it over there, but moved back to be closer to family and have my family. And it is nice here in that everything's close and it's easy. And I actually practice in Fairmont with Dr. Lisa Flower, and she and I met through residency. And we've been there together for 14 years now. And we both, as far as family medicine, kind of the same as Dr. Plackey said, we really like all of medicine and, helping your patients, get through all stages of life and making sure you kind of stay ahead of any problems that come. And we really, being in a small town like Fairmont, we really do have the whole family in family medicine. So that's always a lot of fun too, seeing the babies, the grandkids, the grandmas. So
I didn't know you and Dr. Flower go all the way back to residency. That's great.
Yep.
Oh my gosh, that's great. All right, Dr. Sakalaridis.
So I'm actually from the Northern Virginia area, and I went to undergrad down at VCU in Richmond, and then went to medical school at WVSOM in Lewisburg because I was interested in the osteopathic realm of things. So it was there and I started looking at different residency programs and came to Morgantown with Mon General's first residency program, and really liked it here a lot. And ended up staying here and doing that here. And then I met my husband, who's from Brewston. So we decided to settle in Morgantown. And during my residency, I did a lot of different rotations, and one of my rotations was out in core with Dr. Haran. And so Dr. Haran was getting to the point where she was going to be retiring, and I really liked the patients there and the staff there, and so I decided that this would be the best place to kind of establish things. And so I've been there for about 5 years now and really enjoying it. I've really liked family medicine because you get that whole realm of everything. And also the preventative aspect of things. I think it's very important to really help patients have good quality of life, and really feel like I can do it best in the position that I'm in.
Sure. Beautiful location too. Yeah. I love it out there in core. All right, perfect. So the first question, very important now. I know I've heard about it so much lately, especially after during COVID. So depression, we're not just here for primary care, but how can I seek help for depression? I don't know if all three of you want to take that or someone wants to start, but that was the first question.
Well, I think a lot with the COVID pandemic right now, we're seeing a lot more of it. People have been isolated for a long time, and so what could have been there previously is coming out a lot more. And I think it's really important for when patients come in for their appointments to discuss it with us and let us know how they're feeling, and we can kind of help them on the lines and what to do next, and start whether it's medications or counseling or just talking to us. There's a lot of different ways that we can help as a starting point.
Sure. Did you see an increase of this during COVID, and even after COVID, I'm sure?
Yeah, definitely. Yeah. Yes.
And also too, I think patients are more comfortable talking to their primary care doctor than they are to a specialist. Yeah. So we usually are the first ones that they mention it to, or even are willing to admit it to. So that helps us too to kind of point them in the right direction as far as treatment and stuff too.
Sure. So. Perfect. Thank you. Next question. How can I combat my allergies? Oh, because they have been bad. So I've heard that even from friends, family. Who wants to take that?
I tease my patients that they'll come in with their runny, stuffy noses this time of year, and they'll be like, "Well, I never had allergies before," and I'm like, "You're from West Virginia. You have seasonal allergies. Sure. Like, there is no ands, ifs, or buts about it." So, I do believe that they have been particularly bad this year. I'm not sure exactly why. I guess the warm and the moisture. I have no idea, but trying to stay ahead of it, I think, is a big part of it. I think people get so down with all the congestion and just fatigue and mouth breathing and all that trying to stay ahead of it, getting medication on board faster is one way to help combat that.
Yeah. All right, next question we have. Ticks and Lyme's disease. What symptoms do I look for?
Well, ticks are rampant this time of year, and especially if you're outside, you're going to be exposed to ticks, especially if you're out in the woods, going hiking, even out in your garden. We see tons of bug bites in general. So look out for, check your skin every time you come in from being outside, when you're showering later that night. If the tick's attached for less than 36 hours, you don't really have to worry, but if it's more than that and you catch it before 3 days' time, you can actually get a prophylactic dose of an antibiotic, just one dose, and you can pretty much not worry about getting Lyme's disease. But a pretty classic sign is like a target-like rash, but that's not possible every single time. You can have just a general red rash, or you can have muscle aches, fever, neurologic complaints, even some, palpitations, heart problems too, long term. So we want to try to take care of it as soon as possible.
Have you seen an influx of those this time of year? I'm just curious. A lot of people.
Almost every day.
Really?
And I feel like too, people are going out and vacationing this year. So they're going back to their camps, they're going back to their outdoor activities. And so yeah, we're seeing quite a bit more right now.
Next question actually goes along with that. People are out and about post-COVID, so how can I enjoy myself and still stay safe? What activities can I do and still stay safe?
Pretty much anything outdoors is safe, and anything indoors in small groups that, you know, people around that you trust, especially vaccinated people. If you're wearing masks, pretty much safe just in smaller group settings, I think.
Next question. What is the best way to find a primary care physician who is the best fit for me? Because it just depends on your age or your...
Well, I've been doing it the longest. So I'll give you my 2 cents on that. Okay. Not every patient fits every provider. And, you know, I believe that going into family medicine, you know, we understand that and we just want to always do what's best for the patient. But if the patient isn't feeling that same connection, or if they're not feeling that same, you know, trust and rapport, they're always more than welcome to seek another provider. You know, unfortunately, primary care is very busy right now. You know, there's a lot of patients who are without a primary care doctor and they need to establish with a primary care doctor. So trying to find one is difficult, and then, you know, if you don't necessarily jive with the first one, trying to find another one, you know, it is difficult. It is. But not every shoe fits. So,
and also, yeah. I mean, the other part is it too is primary care has changed a lot. Medicine has changed a lot with time, and so what you might be used to in the past might not necessarily be how things are happening now, or what's best. So, just taking that, it might take more than one appointment to actually build. It's going to take more than one appointment to actually build that rapport with a primary care doctor. So you just got to give it a little bit of a chance and understand a little more. You know, what the goals are for both people. But I would say definitely at Mon Health, all the PCPs are there, like, and really trying to do a good job in helping. So
yeah, perfect. Okay. At what age should my teenager switch from pediatrics to a primary care? Great question.
Anytime. I mean, I think we're all family medicine, so we can pretty much see any age. I know my office particular, we don't have as much of the vaccines for the younger kids, so we see mostly from 11 and up, but, you know, some in between. But I think you both see anytime.
Yeah, we see from newborn to newborn up, so anytime, you know, they feel comfortable. And but it kind of goes back to the family medicine thing too, since we're in more rural areas. You know, we really do see the whole family. So, you know, usually we're their first doctor and their last at times.
How you see patients grow up.
Yep.
You know, you probably start from when they're little and then they become adults. Next question, kidney stones. We had our Facebook Live with urology last month, and it, you know, almost the whole segment was about kidney stones because it's just it's so much. So should I see my primary care physician first and then be referred to a urologist, or what should I do if I have kidney stones?
I mean, the first step is definitely going to be seeing the primary care if you don't already have a urologist. I mean, if you're already being followed for that, that's a different story. But if you're thinking you have them, then seeing the primary care, because it might not be a kidney stone. It might be back pain or just a UTI or a UTI. It could be several different things, and it might not be a kidney stone right off the bat, too.
Okay, gotcha. Thank you. Next question, how often should I see a primary care physician? How often should someone come to you?
At least annually. Okay. We try to do the annual wellness visit, make sure you're up to date with all your preventative health and, you know, blood work, vaccines, things like that. And then kind of depends on your chronic conditions after that and what kind of acute issue, you know, you maybe came in for. So it can vary, but depending on what we're treating you for, I'd say, you know, diabetes maybe every 3 to 6 months, depending on how well you're controlled. Hypertension maybe every 3 to 6 months. But if you're pretty healthy generally and you don't really need a lot of maintenance, it could be just once a year.
Okay. Perfect. Kind of a question to go along with that. So should I see my primary care doctor for my annual, or should I go straight to my gynecologist? Curious.
We do all of that too. And again, being female providers, I think the patients feel very comfortable just staying with us to do that. Sure. But of course, I mean, I don't think any of us are delivering babies in our practices.
No.
I mean, we're not doing obstetrics with family medicine, but so, you know, they would definitely follow with them through those childbearing years and stuff. But for just general gynecology, we do that too.
Okay, perfect. Do you talk to my specialist on my behalf, like a cardiologist, or how does that work?
We definitely try to stay in contact with the specialist. If something comes up, I mean, most of the time we're writing notes back and forth to each other, but if there's something that we definitely is up and we need to discuss, then we do get in contact with them, or they even get in contact with us too.
Okay. Because I know there has to be a good relationship between primary care and specialists. You guys work hand in hand all the time. So, next question. How or why would I need to see my primary care? I know that's a very broad question, but I mean, it's a good question because people want to know what they need to come to you for. So,
we were talking a little earlier about getting all the annual preventive health stuff, but we do all the other stuff too. You know, we do the sports physicals, we do the vaccinations, you know, for flu, COVID, but we also do sprained ankles and, you know, belly aches and headaches and, you know, as far as evaluation, or at least initial evaluation, and maybe an initial treatment, you know, while we're considering specialty or testing or something like that too. So
I think it's nice to see people too, like right off the bat when they're healthy. So like to get them in just to establish care when there's nothing going on, because then we can kind of tell what their baseline is and know, okay, you're really sick today, versus maybe it's not as bad as we think it is. It's hard to say sometimes if you don't know them and they come in really sick for the first time.
Perfect. Okay. Next question. How do I know what screenings to get and when and at what age? So if, you know, I'm guessing, you know, if a woman's in like her mid-30s or 40s, you know, how do you know what to get?
I mean, at your regular wellness visit, that should definitely be the conversation that happens between your PCP and you. Okay. I think that's also the important thing to focus on too, is that once a year appointment is to focus on those screenings and wellness. And so if there's a bunch of problems going on, it's very difficult to focus on that. And so things can be missed that way. So if I have a patient come in with a lot of different problems, we might just focus on that and then go to the screenings next time. But it's very important to try to do your wellness with your PCP at least once a year.
Gotcha.
So that can be discussed.
Okay, good question. We were talking about vaccines earlier. Are COVID vaccines available at your clinics?
Yes.
Yeah. Okay. Just got them. Alrighty, perfect. Next question. How do I know if something is infected? Is there a certain way to know?
Red hot tender.
Red hot tender.
Yeah, if you have a fever.
Okay.
Chills sometimes if it's a really bad infection.
Okay.
Drainage sometimes.
Yep.
Alrighty. How high is the risk for heart disease? I wonder, does it depend on family history or?
Family history would definitely play a role with that. Other risk factors as well, like if you have high blood pressure, high cholesterol, if you're active, diet, if you're overweight, all of those will increase your risk for heart disease. Am I missing any? Smoking, yes, definitely smoking.
That's the part. All right. Primary care or emergency room? How do I know where to go? Great question.
Yeah. If it's something that you know, is actively happening, you know, if you're actively having severe pain, actively, you know, bleeding, then you should go to the emergency room. but if it's something that has been going on for, several hours, several days, then by all means call your provider first and see if you can get in with them, soon to discuss those symptoms and problems. But
You think I guess it's hard for someone to know if they're going to need a CAT scan or like immediate blood work, but those are the things that need to go to the ERs, things that need to be worked up with a lot of imaging or, labs, other testing that, we might not have in our clinic. So that was the only difference I could think of.
I think that contacting our offices, though, too, a lot of times we can still see patients same day. Whether or not it's with each of us individually or somebody else in the office, somebody will be able to see you, and if not, then that's when you can speak to a nurse or something that can instruct you on what to do further.
Perfect. Okay, thank you. Next question, is there a reliable internet source for health information? I don't know if you have patients coming to you a lot. That's a good question, though. A lot of patients are like, I read it on this site. And you're like, don't take that for what it's worth. So anything you guys suggest? No. Hard no. Yeah.
There's some resources that might be helpful, but I can't think of like a name of a website off the top of my head. But I know people come with some valuable information. It just has to be like a .edu or like a peer-reviewed site or a something like that.
The U.S. Preventive Health Task Force, they have information, the CDC has information, so the federally funded programs, I think, would be a very safe bet, yeah.
Okay, perfect. Next question, how does my family history affect my health?
You have a more likelihood of having potentially, not everything is hereditary, but if your family has diabetes, there's a good chance you could get it if you're not following the recommendations and diet, exercise, stuff like that. So I don't know if you guys have anything.
Okay. Next question, RSV is going around my daycare. How do I keep from spreading this into my home? We were just talking about RSV.
Yeah, we were.
Yep. Yeah.
Oh gosh. So spreading RSV, not getting it at daycare is going to be something that's very difficult to do unless your kids are just not in daycare. They're too young to wear masks, and they're going to put stuff in their mouth. And so at home, if you're trying to personally not get it, wearing a mask might help prevent that contact, but washing your hands, still washing your hands, number one thing. But it's really hard to prevent. It is.
What are some signs for RSV? What are some symptoms?
It's pretty much like a regular viral illness. It's just certain children may have worse symptoms than others, especially those predisposed to have asthma. So they can have, wheezing and, a deep cough, but a lot of times it's upper respiratory too. It's runny nose. It's, just general malaise. So it looks like any virus. Fever,
It
yeah.
can have a higher fever
Can have a
than some
fever.
of your typical viruses would.
Okay.
So.
Gotcha. Thank you. Next question. Why did you each choose Mon Health? That's a good question.
I chose it because, my husband did his rotations in med school here, and he's from Ripley, West Virginia, and he really wanted to come back. He liked the atmosphere a lot, and so yeah, everything worked out great, and we both like it here a lot, so that's how we ended up.
Being from Morgantown, my family always came to Mon General for their health care, and when I left and came back and joined with Dr. Flower in Fairmont, initially we were with a different system, and then we were on our own, and we really thought long and hard before joining another system because, once bitten, twice shy. Things, like you said, change in medicine all the time. And so, when we sat down and talked with Mon General and got to know the other providers and the administrators. It just seemed like it really was a cohesive group of people that really wanted to provide good care, and you know, we wanted to be a part of that too, because you know, we felt strongly about what we were doing in Fairmont, so we felt like that kind of aligned with our goals and ideas too. So.
And speaking of your Fairmont location, for the patients who are watching, you'll be moving soon.
Yes.
So Dr. Bonfili, Dr. Flower, and Rebecca Wilson's clinic will be moving over to Technology Park. You can see the sign when you're heading. 4 weeks, that's right. So when you head down south on 79, you can see the Mon Health sign right off to the right, and it's in the making.
Yes.
Yeah.
We're very excited.
Very excited. Yeah.
Very excited.
So what brought you to Mon Health?
Well, again, when I was looking at the residency programs, I just had a very good feeling when I was here. I liked the small community hospital aspect, and once I went through that, and then I developed a lot of relationships with a lot of the specialists, and it's just been, it's been worked out ever since. So.
Perfect. Next question. Best advice for staying safe and healthy this summer? Best advice. That's on everyone's mind. That's a popular question. I know you said staying outside. Sunscreen. Sunscreen.
Yeah. And with the humidity, you know, because we live in West Virginia, we do have patients with COPD, emphysema. The humidity and heat can be really difficult on those patients. So making sure that you stay, you know, in the air conditioning, make sure you're using your maintenance medications regularly to try to keep yourself as healthy and feeling well as you can. Yes, yes, staying hydrated, and but being outside is a good thing too. The other thing I think we probably all have seen a lot of since COVID is the quarantine 15. You know, a lot of people have gained weight, and their diabetes has gotten more out of control, and way more sedentary than they've ever been before. So again, you know, being outside it's good both for your mind and your body, but you know, trying to do it safely, you know, is important.
Yeah. And don't forget, your COVID vaccines are available at all the primary care clinics, so that's very important. That's because that just became available, just the past couple of days. Yeah, so.
Right after the holiday. Yeah, okay. yeah. Perfect. The 6th, yeah.
All righty. Thank you all so much. That was perfect. We appreciate all of you. Thank you for joining us tonight with your wonderful questions. We will see you in a month. Thank you again. Have a good evening.